So I'm going to talk a little bit about diagnostics. So all the different types of testing. We would quite like to do something surrounding this for obviously World Aspergillosis Day is coming up next month. Yep. And it would be really nice to do something to do with people's test results. We thought could be, so I think last year did we have the theme of fatigue? I can't remember now. When we're talking about diagnostics, there's these sort of 4 different main purposes that it can be for. So there's getting a diagnosis in the first place, so at the start of your treatment journey, and then throughout the treatment journey, there'll be other tests that are done to see whether the disease is progressing or whether it's clearing up a bit in response to treatment. And there can be blood tests to measure the antifungal levels in your blood to see if your dose needs adjusting. And then late in the treatment journey, it can also detect resistance, in which case that tells you that your options have become quite limited. So there's different tests happen at different points throughout this journey. And there's quite a lot of different tests, and some of them are quite technical. So it would be, what we'd like is, it would be really good to have some resources for people at the start of this journey to know what's coming and to know how to understand what they're being told. So last year we did a lot of training for the doctors and the lab staff. So we did these webinars and we've put them out as YouTube videos. So we covered beta-D-glucan and galactomannan and the therapeutic drug monitoring, so like voriconazole or itraconazole. So we showed doctors and lab staff like how to run the test and how to interpret the results. But what we didn't really do anything really of was finding out what patients and carers need to know about this kind of thing. And obviously it links together, because what we want is for the doctors to know what kind of information to give you, what sort of language to use and how to explain it, or if there's videos already out there that explain things a bit better. We want to know what you guys find useful, so that when you go to your appointments and you're told your IgE level has gone up to whatever number, 1500, whatever, what we'd really like is for you guys to know what that means, like really appreciate what it means. Because during the appointment, they're short, and especially if you're getting bad news, it can be quite a lot to take in all at once. And if you come away thinking, oh, actually, what was that again? Some things can seem like they made sense at the time, but then you get home and you think, no, I didn't get that at all. And so we quite often get a lot of people coming into the Facebook support group saying, my test result was this number. What does it mean? I don't know. And that's not a great thing to be happening, because for a start, different where you get like a normal value or an abnormal value, different laboratories will have different ranges for that anyway. So unless you've been told what the range is for that specific lab, it can be quite misleading. So if you've got somebody from the UK saying, my test result came back as 5, is that good or bad? If somebody from the US with a different lab system tries to answer that question, you can get crossed wires quite quickly. So what we'd really like to get is like know what set of things you guys need to know and what problems you've come up against. We'll do that after. So I thought we could have a little bit of a discussion, if you don't mind, on this sort of a subject. And I'm going to write down what you've said, and that will inform a bit of what we do later, to try and help with this kind of thing. I know it's kind of a big subject area, and if you think of anything later, I'm going to set up a thread on the Facebook group as well. So if you think of anything later, you can add it on there. So probably, well, you get different tests, obviously, depending on whether you're CPA or ABPA. But things like PCR cultures, antibody tests, and antigen tests, all the laboratory stuff. And then you've got things like radiology, like CT scans or X-rays, is a bit separate as well. So out of any of these or other things that you've come across during your treatment, are there any tests that you find particularly confusing?
I don't know what a PCR is. I've heard of it, but I don't know what it is. I can't remember.
Okay, so maybe if we had something that just gave like an infographic with just a quick overview of what each thing might be good.
Yeah.
So PCR, that is where you measure how many copies of a piece of DNA is present. So say if you have like some samples from deep in the lungs, you'd run the PCR test, and depending on how much Aspergillus DNA there is, that'll tell you how much of a fungal burden you've got. Just
Okay.
roughly.
Sorry, Beth. So could that PCR be from sputum?
Yes.
Okay.
I think we can do.
Maybe. Depends what's in the sputum.
You can do it on sputum, or when you have a bronchoscopy and they wash that fluid.
Okay.
When I first had mine done, I had an Aspergillus LGG elevated at 120, but no one told me what that meant.
Okay. Hang on, sorry, I'm just. Did that make it quite that would probably have been quite worrying to be told?
Well, I was told that, and I was also told because of my asthma, it was and I had to wear masks for cleaning and housework. And then she sent me to a specialist who laughed and sent me away and told me it was all ridiculous and there's nothing wrong. And I've been diagnosed with fungal sensitive rhinitis as well.
Okay.
So I'm just a little bit confused as to, because I'm at the very, very beginning and everyone else is quite advanced and things, and I don't know where it's heading. If no one understands what it is, my doctor hasn't got a clue, although he tries to be helpful. And my ENT specialist has been doing scans and checks every 3 months, apart from since we've been in lockdown.
Yeah, so I guess something like if they said your IgG is raised at 120, if it's still above 100 next year, we would do this treatment. Would that be something helpful?
Yeah, they haven't said there's no that would be helpful, yes, but they've said there's no treatment necessary.
Okay.
So I'm a little bit confused as to whether it does need treatment if it continues to get worse, because in the last few months I've started having the night sweats again like I did before. And yes, I've started again with the night sweats, which my doctor dismissed as menopause. But when I saw the respiratory doctor, she said, no, that is signs of the Aspergillus. Because it's only at night. I don't have them at any other times. And I get a raised temperature with it as well, which you don't get with hot flashes. Yes, I didn't know that until I was told that. So I'm confused because I put my symptoms on here. I think I had, when I joined, I put my symptoms on there and it came back that I've probably got SAFs with the severe asthma and the Aspergillus and things. But when I saw the specialist, he seemed to think it was quite funny.
Not professional at all, is it?
No, so a little bit confused as to, how to go forward.
I like the way my consultant deals with it. I haven't had any of these figures ever given to me, or IEG or results. He simply says, here's your CT scan or your X-ray. This is your fungal ball. This is how it's too big, too small. And then he tells me what medication I'm going to have. So at the end of every test, whether it's a blood test or whatever, it's always been the case of, it's okay, we don't need to change your treatment. So for me, there's never been any confusion or worry, thinking, is that result too good? Is that result bad? So I think what we need is the person who's done the test and giving you the figures to say, they're normal, you haven't got to do anything, or they're slightly abnormal, we've got to increase your medication, as opposed to just giving you the results of the figures.
Yeah, I think that came up before as well when in some of the Zoom meetings. I think was it Kate? Somebody had Klebsiella grow in their cultures, and they were told that piece of information, but they weren't told what it meant at all.
Yeah,
and she was quite upset by it. So, kind of being given information that's not connected to anything can be quite harmful sometimes.
yeah.
I agree with that, Beth, because you can be given results and without any explanation, depending on who you've seen.
Yeah, I think it can be difficult for doctors sometimes, because especially if they're seeing kind of people back to back, like you log in, you just kind of scan down the list.
Yeah.
You like if you're a doctor talking to another doctor, you would say something like IgG is raised at 120, and it's difficult for them to kind of get into the other mindset of a patient doesn't want that information.
Yeah.
That way.
I think we've always been told just that your aspergillus levels are keeping pretty stable, or they've gone up slightly, or they've been raised a lot, so therefore we'll do this. I don't think we've ever been told use the IgE at all, ever.
I've had numbers, but like you were saying earlier, I think, Beth, not how does that relate to anything? To me, it looks a big number. I haven't got a clue, really. I just want to know, is it important? Am I going to notice my aspergillus get much worse if it can't be treated? That, a bit like Mick said, really what you want is a summarised version, because I think it is a very worrying disease. And I think, I don't know, I just sort of think personally, we don't want any more worry. Just, yes, it's got worse. Hopefully it's getting worse slowly, so it doesn't matter too much, or it's getting worse and this is a medication,
Yeah, less uncertainty.
Yeah.
Helpful, Beth, is that we explain what each test is for, why it's indicated, and what we're looking for in them results. But I agree with the patients. I don't know if they need to know the detail of numbers or specifics, because we base most of our results on, if you don't hear from us, you assume everything's okay.
Yeah.
We would ring you and direct you, and we'd contact your GP with instructions on how to action that result. So I think it's a good idea to explain what each test does and why we do it, but I don't think it needs any further breakdown for the patient, because I think it is another piece to worry about if they get caught up in the numbers and they, going up and down and, this way and that. And some patients also have a trend for having a particularly low level of something, but that's them, and that goes for all tests. Some people just universally have a low white cell count, but that's just they're part of that population that do. So I think we get caught up in the numbers if we're not careful.
That's what I'm a bit concerned about, because I've seen a lot of people, especially on social media, People saying, oh well, I've got my my general blood test back from the doctor. I was towards the bottom of the range for whatever vitamin.
Yeah.
Therefore, I've gone out and bought a kilogram of this stuff online. And
No.
no, that's not how it works.
We need to say what it's for, but that points out that this can vary from individual to individual, and also changeable within time as well. I mean, one week you might have, you know, a low hemoglobin, but you've eaten a load of, you know, spring greens, and the following week it's okay. So if we get kind of hooked on those numbers, we're going to find ourselves, because, to be honest.
The other thing from our point of view, you get given a number of the IG, big G, little g thingy, and that's, you know, the doctor will say, oh, it's, you know, it's a bit high, but you're always high. And my husband in particular is always looking for, well, what's your trigger point? You know, if he wants to know if it gets to, I'm going to make the number up, if it gets to 170, does that mean, is that a trigger point? Or I think the truth is, probably it's not known. It depends on how I'm feeling with that number.
Yeah.
Do people who go to the NAC clinic and other UK clinics get these actual results in numbers as a general rule, or do you have to ask for them?
Well, I always ask.
Right.
Don't ask.
I've never asked.
I was originally told many years ago about inflammatory markers, and they signified to me how poorly I actually was. So every time I went into hospital or went to the doctors, I'd ask about my inflammatory markers, and I became obsessed. Well, I wouldn't say obsessed with it, but I always asked. And I used to judge how poorly I was, not on how I felt, but on what my inflammatory markers were reading.
Yeah. So the actual numbers were what you hung your hope for the future on, depending on which direction they were going. And that can be a bad thing, and it can be a good thing. I mean, overall, I guess it's a good thing. But like a lot of the numbers that Beth's probably seen on social media come from the American system, where your results are your results, and you get the whole readout.
It's going that way here. My GP started.
Yeah, it does happen here as well. Yes, yes, absolutely. Yeah, sorry, Beth, I didn't mean to. I think most doctors I speak to will say, well, really, what you need is interpretation rather than numbers.
Yes.
As a general rule.
And especially if something's outside of if something does seem high, I think people forget that, you can get the placebo effect, but you can also get the nocebo effect. So like if you're told your inflammatory markers are high, you think, do I feel worse? Maybe I do.
Yeah, definitely.
Yeah, absolutely.
That's my worry. I think, like you say, it's down to individuals, isn't it? Some people love the detail of what's going on, but some people are just happy to.
I quite agree.
That someone else monitors it and trust that they're dealing with it, and they'll tell you if they need you to know. Is most of it, but.
But if the explanation is either insufficient or not right, or is forgotten completely, and you're just left with this number and I don't remember what he said. Then that's a problem, isn't it?
Yeah.
I think there's a bit of a problem. Is it working?
Yeah.
I think there's a bit of. Is it working? Yeah.
We can hear you.
There's a bit of a problem when you ask for fungal levels, and they ask for full blood count, etc., to go to your local hospital, and for them, the GPs then to send it to NEC, and that doesn't happen.
Oh, they just don't send it through, or they don't?
No, they just don't do it, no. And I said, whose responsibility is it? Is it the secretaries or the person who's taking the bloods? And nobody seems to know. So it just gets bypassed, I think. I only found this out because I had to speak to one of the nurses and she said, we haven't got any of that information.
Yeah. When I've had a blood test done locally, like you say, that has to be, the results have to go to Manchester. Pre-COVID, my GPs are only 10-minute walk up the road, so I go back and forth. Have you sent it to Manchester yet? Have you got the result? Have you sent it? Oh, we haven't got their fax number. Can you? And they will say to me, can you get their fax number? I'm like, oh, for goodness sake, I'm not being
Piece of paper.
So so on that note, I have a couple of weeks ago, I've actually rewritten the documentation that you get for your IgG, your IgE, and all your levels to make that, because I knew there was some issues coming up with people there. So that is now clearly obvious where it is on the page, and I think it's a bit more kind of it's all there, who the likes of the FBC and the LFTs go to, and who your levels for your IgG and your IgA go to. So that hopefully that should be a bit more resolved in terms of the paperwork side of it.
Because my GPs will even say to me, oh, you can tell them the results, we'll print them out and you can send them. And I'm like, oh, no. You know, I don't know if the email I've got, I don't know, but no, they have to be chased up.
At least you know they're going to get there if you do it.
There is that, Nick.
So one of the things we could look at is, because Hospify, now I'm literally just thinking this off the top of my head, because Hospify is a secure app, obviously we'd need to discuss it further, but one of the things we could do is you could send them as an image link through Hospify, as a document through Hospify to us, and we, because it is a secure system and it has been designed to do that, so then we could pass your results on from here. Perhaps that's something we could look at doing if you were in that situation. So yeah, if you want to make sure they get to us.
Or directly from the GP. Surely the GP could be a member.
Yeah.
Or when we get this new
Hive. Yeah, there's an awful lot coming there, but that's a whole other meeting.
Yeah, I'm not going to get into that today, but
no, and you think it would be straightforward, because now they get the letters electronically, so why can't we send stuff in the reverse? I don't know whether that's something they...
Yeah, there's a difficulty in there. You can email NHS to NHS, but not out to the patient and then back.
No. But that's going back to, say, the patient having to do it. Surely the GP can just send it back via that link.
Yeah. Okay. Is there anything that you wish you had got maybe at your first appointment, so when you first get told you've got aspergillosis? Was there any information, anything you wish you'd known up front that you didn't know about, or have you found you've kind of had the information you've needed as you go along?
Probably that. I think there's only so much you can take in initially, because it is a bit of a body blow anyway. So I think you learn as you go along, really.
Yeah.
I think it depends on your consultant. Mine simply told me, this is what you've got. You've got the fungal ball. There's no cure, there's no treatment. We might have to do surgery later. We'll try you on antifungals. We've just got to manage it. It's pretty well summed it up.
Yeah.
I think part of the problem is, well, as many as you probably know, I was originally diagnosed with TB. And when I went from TB to aspergillosis, it was a bit of, sort of good news, because even though being infected with a fungal mass, it seemed a little bit better than having TB, because TB had such a reputation at the time for, especially from my parents' point of view, that when I was diagnosed with a fungal ball, it seemed a bit easier. Now, I can imagine that things have changed quite a bit now, because when you tell somebody they've been infected with fungus, it's a bit more worrying, shall we say, than just having any general illness, because people know what fungus is.
Well, my consultant said to me when I was first tested for cancer, and he said, the good news is you haven't got cancer. So my whole impression must have been, oh, relief, isn't that good? But then he said, unfortunately, there are lots of other nasty things it could be, which are just as bad as cancer. And yes.
That's quite common, isn't it?
Yeah.
Okay, so sort of how serious is it? It is relative to other things like that people already have in their heads that they've already got a mental space for, maybe. Okay.
Well,
So do you feel like your GP understands the test results?
My GP hasn't got a clue. His system doesn't even have the his system didn't even have the blood tests on it that my consultant requested. He had to apply to the hospital to get it. So he doesn't understand them at all. He actually told me that. So it's not helpful.
My GP.
Yeah. Sorry, go on.
Yeah, my GP understands COPD, which I've got as well as aspergillosis. So he treats me for COPD. If it's the Asper side of it, he says, not a clue, you're a complicated case. I'll leave that to your consultant.
Yeah.
So he just puts his hand up and says, don't know, can't answer that.
Our doctors both retired, and when Doug saw the new doctor, they'd never heard of it.
And this is only a few months ago.
And when we contacted the GP surgery to say, we don't seem to be getting anything about being clinically vulnerable, they said, well, you're not. And we had to go through, yes, you've had a letter from the hospital to say that, because his original letter came from the hospital. And when they looked it up, oh yes, we'll put you down in the notes as a problem.
I won't mind, but I've had the disease for
25 years.
25 years.
So that's why we sort of worry that, when it comes down to the vaccine and stuff, that you get overlooked because they haven't a clue.
Yeah, we had that problem getting on the original list by when I told the GP I hadn't received a letter. The receptionist just quite bluntly told me, well, there's nothing wrong here. What's the problem?
Yeah.
I asked her if she had read my medical notes and records at the surgery, and she ignored me. It was only when my wife sent a rather blunt letter to the doctor with a very big smile that all of a sudden he registered both of us. Her as my carer, because she said, what happens if anything happens to me? Her concern was if anything happens to her, who was going to look after me? And straight away the GP agreed that, oh yes, you should be registered.
I think the whole, well, I mean, I haven't got the illness, Doug has, but I live with it. And I think that it's bad enough without, your first protocol, which should be your GP, you can't get sort of through just how serious it is. Especially as he's not on any medication, because the fungus is resistant to everything. So they just say, oh, you're not on any medication, you must be fit.
Yeah.
Anyway, not to worry.
Yeah, I think generally the GPs don't really understand the condition. I don't know about the test results, and my concern as well is just, are they picking up new patients before it goes too far,
No.
No, they're not, I know.
No.
But there's loads of asthmatics, and I tell people openly what I've got, And I see, if you know anybody with serious asthma who has loads of seemingly chest infections, tell them to go and, say to their GP, they've possibly got fungal infection going on. Can it be investigated? But
so this year, one of the things that we're going to be looking at is producing a lot more information about what aspergillosis is, and so you will see in the coming months a variety of information that will be available through the MFT website and through other sources, where you'll be able to refer people, say, go and have a look at this, and see if this fits. And also it'll be quite good as well, because then times when you're struggling to explain. I mean, I know most of you have been diagnosed for a long time, but for patients who are struggling to explain, you can kind of, to friends and relatives, you can sort of just steer them in a direction and say, go and have a look at this, and it'll hopefully explain things a little bit better. But we are working on developing more resources that'll help people get diagnosed sooner.
Previously, when I tried to point my GPs to information Prof had given about the number of probable aspergillosis patients in Wales, because of all the lung disease from the mining and everything else, he said, oh, well, unless it's in the thoracic whatever, I can't go by anything else other than what the thoracic journal tells me, something like that. And I thought, oh, I just give up.
Especially for things like SAPS, where it's not everybody has accepted it as a real thing.
Say that again, Beth, sorry.
SAPS, the severe.
Oh, SAPS, yes.
Sensitization, yeah. Opinion.
So this goes. I suppose you could not necessarily link it to what I was talking about earlier in terms of information, but this is one of the reasons why we're going to be putting a lot of the information that's relevant to GPs and patients is going to be going onto the MFT website, because obviously the MFT website is a trusted source. So if you're directing your GP or anyone like that towards that site, then instantly they know that, yeah, this is a site that I can trust and believe the information on there is correct. They won't have to just turn around and say, oh, I can only believe it from here.
What were the initials? M for Manchester, FT? Or?
Yeah, so it's the Manchester website. So we already have a National Aspergillosis space within that, but at the moment we're working to develop that further to bulk up the content on there. It's taken a while.
Manchester Fungal Trust.
No.
Is that what it?
No, it's Manchester Foundation University Trust. So it's the actual, because obviously NAC is part of Manchester Hospital, so it kind of falls under that.
Okay.
You can link to it if you're on the Facebook page, the main Facebook page, not the carers group. There is a link that'll take you directly to the NAC page from there. As I said, there's not a lot on there at the moment, but we're all working on bulking that up and making that more accessible and a bit more of a hub for content. So your GP shouldn't be as quick to question where the information's coming from then. Hopefully that's,